will be brief because we don't want to disrupt the operations of this amazing place at the Albany College of Pharmacy, the College Parkside Pharmacy. Why are we here today? We're here to talk about the fact that birth control is part of the whole array of healthcare services that we believe should be more accessible to women. And I want to thank Senator Toby Ann Stavisky. She's not able to join us this morning, but also Assembly Member Amy Pollan for reminding us that we can do more here in the state of New York to make contraceptions much more accessible to the public. I want to thank Commissioner James McDonald for his leadership on what we're about to do in a couple moments, and Dave Shipley, the CEO of the Whitney Young Health Center, for welcoming us here today. And to all the patients who are being very patient with us, we'll be out of here in a couple moments. This is a big moment for women of New York. Up until now, you could not walk into a pharmacy and be able to purchase contraceptions to meet your various health care needs. And as a result of legislation that was proposed and we signed last year, starting today, any woman walking into a New York State pharmacy will be able to purchase birth control, the best birth control method that meets her needs. That's especially for women in areas where there aren't as many practitioners available to them, our rural communities, low-income populations, which oftentimes are medical deserts, and those that are least likely to have access to a doctor. So it's a new era for New York State, for the women of our state to deal with whatever health care needs that would be met by access to contraception. So reproductive rights continue to be under attack all the way from Washington to state houses across our great country, and just another way to reaffirm our commitment to making sure that women in the state of New York have all these rights to reproductive freedom as well as to access to contraception so they can make their own decisions about their bodies. So with that, I'd like to turn this over to Commissioner McDonald to sign the order. I want to read the order to us.
Thank you, Governor. I'm hereby prescribing this non-patient specific order to dispense hormonal contraceptions as defined by State Chapter 128 of the Law of 2023, Chapter 128, as amended by Chapter 90 of the Laws of 2024, has made Chapter 128 retroactively to January of 2024. Specifically, pharmacists who are employees, volunteers, or contractors of the pharmacy licensed in New York State may dispense hormonal contraception. So, let me sign the order.
All right. And I'll witness this. Let me witness it. All right, it's now official. Great state of New York. Contraception available at the pharmacy. Here we go.